And it hurts me to know that young women and young men like me just need another chance. And I know it is not an easy road, especially when you're traveling alone. Most of them are just victims of their circumstance. So they deserve another chance. So let me give them one more chance. One more chance. Hey, they deserve one more chance. Hey, let me give them one more chance. Hey, hey, I long for the day when our women will not be so vulnerable, and they'll be valued for their quality.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use the lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday.
It is Wednesday, the 17th of January, 2024, and it is a sort of nice, cool day on the outside, a bit of light showers. The sun seemed to be trying to peep out or fight a bit with the showers, but many of us are enjoying that, particularly the plants and the livestock. They are enjoying that weather because surprisingly, December is generally a rainy time and it was quite sunny. We had very little rain in the month of December. And so, if we are getting a little light showers, then that is good for livestock. It's good for water catchment areas. It's good for food security. It's good for the earth. And so, let us give God thanks in everything. Good morning, good morning, good morning. You are connected to Health Vibes, your very own health talk show brought to you by the brand you trust the most, Jolly's Pharmacy. I'm your host, Carlton Lando. My co host hasn't arrived as yet, but I'm sure she will be coming in very soon. So I will start off the show without her. But it is a good day to have a good day. Let me say that again. It is a good day to have a good day. No matter what you may be experiencing in your life, there is nothing that the Maker cannot solve. I was just saying last week that um, what we worry about creates is more lethal. What we worry about is more lethal than the worry itself. And so the worry is more lethal than what we are worrying about. That's what it should be. The worrying is more lethal than what we are worrying about. And so, no matter what you might be experiencing, you might be feeling very low at this time, low in body, low in spirit, low in energy. You might be feeling that everything is going against you. You might be feeling that you're ready to give up. There is hope. There is hope. Once there is faith, there is hope. Once there is tomorrow, there is hope. Once there is time, there is hope. Many of us would have gone through difficult times in our lives, especially losing a loved one. We would have said in the past, boy, I wonder what it would be like. I'm sure I'm going to die if my mother dies, or if my father passes away, I'm going to die. And guess what? You made it. Yes, you grieved. Yes, it was very, very tough. You screamed, you jumped, you bawled, you whatever it was. You may have had weeks and months of crying spells and all of that, but you made it. And sometimes you pinch yourself and you ask, but how did I deal with that catastrophic situation? But you made it. And so if you can look back on the many triumphs and victories that you have attained, then it's enough to be hopeful for today and be hopeful and even be more hopeful for tomorrow. So that's just a little pep talk to just give you some energy to make you feel revitalized as you go throughout the course of the day. Just in way of announcement, on the 6th of February, and February is coming very, very soon. So don't think that the 6th of February is very far. It is not very far. So the 6th of February, that's a Tuesday, we will be having our blood donor drive. So we'll be collaborating with the Dominica China Friendship Hospital, the blood bank division of the laboratory division of the hospital, and we'll be having a blood donor drive in Roseau. That is going to be happening at Dr. Lisa Jolly's office. That is on Hillsborough Street. We will give you more details in terms of the location for those of you who may want to come to donate. The whole purpose of it is in preparation for Carnival. So every year we primarily partner with the blood bank and we collect blood, all different types of blood types, rather, all different blood types. We collect blood, at least 1 pint of blood per person, and that is usually given and stored at the hospital blood bank in case of an emergency. And we're not just talking about emergencies like traffic accidents, but even emergencies in child delivery. A woman could be bleeding to death and will require blood. Someone may need an amputation and will require blood. Someone may need to have a hysterectomy and require blood. Someone may need to have some other invasive surgery, an organ removed or repaired, and may require blood. And so we are asking the public to really support the drive on the 6th of February, where we'll be having our Give Blood, Give Life promotion, where we are asking the public to certainly come on and donate blood to and for a worthy cause. Again, I will continue to advertise this as we go along and get closer to the carnival jump up days, which is the 13th, the 12th and 13th, right? The 12th and 13th of February. So, what we're going to do, we're going to take a short break and then we will get into today's topic.
Introducing Jolly's Pharmacy, brand new website www.jollies.tm. It's your time to jump the line. Shop now at jollies.tm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.tm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website www.jollies.tm. It's your time to jump the line. Shop now at jollies.tm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.tm. Jollies Pharmacy, leading the way in healthcare. In healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website www.jollies.tm. It's your time to jump the line. Shop now at jollies.tm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.tm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website. www.
Yes, so we welcome back to Health Vibes. We're so happy to have you back with us. It is generally the most popular health show this time every Wednesday morning on QFM. This morning we are going to be discussing avoiding medication errors. Let me say that again. We are going back into the pharmacology books and we're going to discuss today avoiding medication errors. And when we talk about medications, we're talking about all medications, whether it's in the form of a pill, a capsule, a syrup, an elixir, a suppository, a patch, an eardrop, an eye drop, a nose drop, an injection. Once it is a medication, whether it's herbal or it is synthetic, once it is considered a medication, errors can sometimes occur. As a pharmacist for over 25 years, I have made few errors. And I think it would be very um, uh, it would be deceptive of me to say, well, I have never made a medical error as a pharmacist. And so I can tell you, yes, I have made a few medical errors. I think it's quite a few because I think I can actually count them on my hand and remember distinctively those errors that when they occurred. Luckily and thankfully, I did not have I did not have any major effect that caused the hospitalization or death or anything like that. But it's the same thing. They will tell you if you're an electrician and you never got a zoom, a shock, then you're not an electrician. Or if you're a chef and a knife never cut a part of your finger, then you're not a chef. Right? I don't know what they say about educators. Well, I guess if you have been in the classroom and a child never give you a rudeness, right, then you were never an educator. Right. So I think it comes with any profession that you're in, there will be a little error or two that may occur, but this is what sharpens you and make you even more competent as you go along. So Trudy, how medical errors? You come to the pharmacy, you hand over that prescription to the pharmacist, and in all good faith, you believe that that person knows what they're doing. As a patient who does that from time to time, let's suppose you go to a pharmacy, whether it's in Dominica or Jerusalem or New York or China, you go there with that piece of paper that the doctor wrote and signed. Tell me what goes to your mind when you hand, as a layperson, when you will hand that prescription to the pharmacist or the pharmacy technician, what goes through your mind?
Carlton, a lot. But let me just first say good morning. Carlton, good morning. And good morning, of course, to the listeners of Health Vibes right here on Q95 Radio. I was a little late. Traffic and parking were an issue. But Carlton, as per your question, when I hand a prescription to the pharmacist or I hand over that prescription, I trust, first of all, most times I cannot read the prescription myself. The handwriting of the physician may be so poor that I have no clue what was written. The physician may have said to me what they wrote, but in terms of me being able to read it, the legibility of the prescription itself to me is poor. But I hand it over to the pharmacist with the confidence that they can read what's written and they can interpret and give me the correct prescription. The only thing I may be a little hesitant about or maybe remind or check for myself would be the quantity or the dosage of that medication, because possibly I would have known it's something that I have to take once a day, or it's something I have to take, maybe the physician would have told me, and I have that anticipation in my mind that I'm getting, if it's once a day, I'm getting a 30 tablets or something, you know? So if I get something that looks less than that, or if I get something that looks more than what I'm anticipating in my mind as it relates to quantity, then I would be a little, that is what would maybe alert me. But in terms of the correctness itself of the drug that is given to me, I would be fully confident. So, as a layperson, I would figure it's correct.
Okay, so I'm going to play devil's advocate with you again. You're my guinea pig today.
Mhm.
So, do you think that when your prescription is delivered to the pharmacist or pharmacy technician, and usually the pharmacy technicians are the one that would receive the prescription and begin to interpret the prescription and put it on the system, do you believe that the prescription or that process should be one that should be rushed and should be done without due diligence?
Absolutely not. I hope nobody would want their their process, done without due diligence. There should be time taken to make sure everything is correct, efficient, and everything is good. So due diligence, of course. Absolutely.
So, again, I'm asking you.
Mhm.
So, what do you think makes a great pharmacist?
I think a great pharmacist is made by one, the person's ability to, or the person's knowledge of the medications and their ability to, fulfill prescriptions well or understand and fulfill prescriptions well. The person's attention to detail and the person's attention to, what is being presented to them. Sometimes a pharmacist may have a patient who always comes in for a particular thing, or a patient whose prescription is in the system as a certain thing, and if they're not attentive may miss some variation in that person and their regular, what's going on. Or a pharmacist, for instance, Carlton, when I say attention to detail, a pharmacist that is able to not just fill the prescription but give you some advice. For instance, it happened at Jolly's to me recently. Pharmacist said to me, that is your last month. So that alerted me that
You need to
I need to visit my physician. I need to schedule an appointment with my physician to have my prescription, rewritten, because it's a drug that I'm on consistently. So attention to detail, and of course wide knowledge of the profession, the drugs, the way to deliver them, and that is what I expect of a good pharmacist.
Wow. I did take notes. I'm hoping that I meet the grade. Seeing that you're an educator, you might, you might be able to grade me and tell me, if I met the grade. But truly, let's begin really by looking at the 5 R's, the 5 R principles regarding medications, and why these 5 R principles are so essential in the avoiding, in the prevention of medication errors. And the 5 R's tells us, one, ensure that it is the right patient, because you could have 2 or 3 Trudy Christian, Trudy Christian Wallhouse, Trudy Christian Laplane, Trudy Christian Scott Z. Right? So you just go, Trudy Christian is my name, pam, pam, pam. You pull up a Trudy Christian. You don't ask what is the address. You don't ask, what is the date of birth, because we do have a demographic of each patient on our system.
Okay.
So we will ask you, if you're a first-time customer, can you tell us your name? Can you tell us where you live? Can you tell us your age? Do you have allergies to food? Do you have allergies to medication? We put all of that in the system. So, for example, if you have an allergic reaction to aspirin, if a drug is prescribed for you that has aspirin, boom, the system will alert us that this patient is allergic to aspirin and cannot take aspirin.
Okay.
So sometimes we get resistance from people. Oh, why do you have to know all that for? Are you not my doctor? And a lot of times what we've done is to train the technicians to let them know and tell the patient early o'clock, ma'am, is it possible that I may ask you some personal questions that is important to put on the system that would protect you from any drug interaction,
Mhm.
from any allergic reaction, and would differentiate you from other people.
Right.
So
Carlton,
you
that's interesting.
rationalize early o'clock.
Why you're doing it. But Carlton, that is
Yes.
so interesting because I guess since I, have a relationship with my pharmacy, which is Jolly's Pharmacy, and I believe everyone knows me at Jolly's Pharmacy.
Mm.
I have never even considered, the possibility that there could, when I say my name, that there could be, a mistake, or there could be it might not be the right patient that
Mhm.
is, pulled up. So I never even thought about it because, as I said, the people know me at the pharmacy.
Mhm.
But if you're a new client, for instance, that is so important. And I never gave that the proper consideration. So the right patient.
That's important. The first thing,
Yeah.
the right patient. And I'll tell you, in my 25 plus years of being a pharmacist and having worked overseas too, I have received prescriptions that were written in other people's name.
Ah.
Doctors made error. So the doctor was so maybe engrossed or was still thinking of the previous patient and would write Alice Pinard or Alice John when it's really another person's name. It's you are
Okay.
hailing John, right?
Mm-hmm.
But the doctor still is human error. They're busy and write the name. So that's why it's important when we might say, Miss John, the person like my surname not John. Are you sure? I said, yes, this is the name on the prescription. And when we call the doctor might say, oh, I'm so sorry. This is not XYZ because it could be the wrong drug.
Mm-hmm.
It could be many things. So it's important that the medicine is for the right patient.
Mm-hmm.
And when we talk about the right patient, it also includes not sharing your medication with other patients
Mm-hmm.
because you will do that and you
Mm-hmm.
can actually increase the risk for medical errors.
Mm-hmm.
So a doctor prescribe um, an eye drop for you because you had a bit of red eyes and your eye was itching you. And then your neighbor came by you and your neighbor say they were, I would say, weeding or circling, they were weeding and something went in their eye and the eye red and it's itching them. And you decide, well, I have a drop the doctor had given me and it did me so well. I was having similar thing. And you decide you're going to tell the person, look, take 2 drops of that. It helped me well. Put in your eye. That is something that you want to be very, very, very careful about. It's something that you should never do because the person may have a totally different medical underlying condition
Mm-hmm.
that has
Mm-hmm.
caused that eye problem. So
The right
the right
patient.
patient
Mm-hmm.
includes all of that. The medicine is for you and not for somebody else.
Mm-hmm.
Ensure that when that prescription is written, when the pharmacist asks you a question, you can answer without giving a problem. That's the first R. So the 5 R's, the right patient. The second R is the right drug.
Mm-hmm.
Ensure that it is the right drug. So sometimes the pharmacist may ask you, ma'am, uh, this is cephalexin. It is an antibiotic that you have to be taken, that have to be taken. Antibiotic? But I don't have no infection. Or the doctor write antibiotic for me now. So right away, the pharmacist is alerted and we call you on the side and say, well, what did you go to the doctor for? Blah, blah, blah. And the pharmacist may discreetly, as it's always done, call the doctor and say, doc, I have patient so and so, and they're saying that this drug that you've prescribed for them may not be for them, or it may not be for the condition that they came to you for. So ensure that you are getting the right drug. While I'm on this, let me differentiate as well that your doctor, for example, may write on your prescription Bizide, Bizide, Bizide 2.5 milligrams, take once a day. The pharmacist may write on your prescription benjofluoroside. So Bizide is a brand name. Benjofluoroside is the generic name or the long scientific name. So the pharmacist supposed to tell you the drug that the doctor has written is the brand name, but this is the same medication. This is the long name for it. So it's benzoyl. Many times people get into conflict, people get into confusion with pharmacies, and at times it is good for the pharmacist to ask, if you have the brand and the generic available, which one do you prefer? Do you prefer the brand or do you prefer the generic? Always remember as a consumer that you're going to pay more money for brands than generics. All right? So sometimes people may look at and try to interpret the prescription and say, well, I saw the doctor write Novas on my, it looks like Novas, Norvasc. And I'm seeing they give me amlodipine. What is this? That is not the same drug. Yes, it is the same drug. One is the brand, one is the generic. So it is important to inquire about the drug because you want to ensure that you're getting the right
The right
drug.
drug.
The second R, the
The
third
third,
R
the third.
is the right dose.
Now, that's the part I told you I might be
Yes.
concerned about.
Yes.
The dosage, yeah,
Yes.
the right dose.
The right dose.
Mhm.
Now, medication comes in different measurements in terms of dosage. You could have micrograms, you could have IU or international units, you could have milligrams, you could have um, teaspoonfuls, tablespoonfuls, milliliters, ounces. All of these measurements are used in pharmacology. Drops, right? And so it is important that you adhere to the right dose. We've seen people inadvertently, or should I say, ignorantly altering their dose without the knowledge of the healthcare provider. So they will say, me, that metformin there, 500 milligrams, the doctor said to take a gram a day. A gram is 1,000 milligrams. Okay, so that's the conversion. And they might say, me, 500 milligrams I take in. I don't worry, the doctor. 1,000 milligrams. I take in 500 milligrams. I take it once a day, I take it twice a day. And when they go to the doctor, the doctor recognizing, do your sugar is not, where it's supposed to be. The doctor goes now and say, are you taking the medication? Oh, yes, doctor, I'm taking it. As you say, yes, no. And then the doctor say, well, I'm not seeing a change. I have to top up your medication. Doctor now puts you on 1,500 milligrams twice a day, right? And you vex. So it's important as well that you follow the dosage. I know you want to say
Right.
something on
No,
that.
I was going, as you mentioned, the metformin, and sometimes somebody conversely might look at their blood glucose or look at their blood pressure, see it's high, and say, boy, let me take some extra medication
That's a
to
good
try
one.
to remedy, I'm seeing my blood pressure, and not inform the doctor that that's what they're doing. So they're on 75 milligrams of, something, losartan, whatever, and they just decide, boy, let me take 150. Let me double it to try to bring down my blood pressure. So I know that what you're saying, Carlton, in terms of dosage, we can have instances of people modifying their dosage to their own, for their own.
Detriment.
Yeah.
And then what they don't recognize is that some of these drugs have what we call a very long half-life. That is the length of time it stays in the bloodstream before it is cleared, right? And if you go and overdose, it means that you are increasing the concentration of that drug, which could even cause levels of toxicity. So it could cause levels of almost like a kind of a poisoning in your bloodstream, increasing your risk to side effects that may be undesirable, putting some of your vital organs at risk, especially your kidneys and your livers, which detoxifies or breaks down these drugs. It could also alter your body temperature, your body your blood pressure, your glucose level. So, for example, you're on a steroid, right? You're taking a steroid because maybe you have rheumatoid arthritis, you may have another chronic condition which permits you to be on a corticosteroid, and you recognize, oh, I'm feeling X today. But corticosteroids, they can elevate blood glucose. They can cause your sugar to rise, right? They can also increase or weaken, rather, your immune system, making you more susceptible to infections and secondary complications. They can thin your skin, make your skin thinner, right? So making it more susceptible to breakage. So there are a lot of things that pharmacists know and medical doctors and so forth know. You may not be aware of it. And so, yes, you might be looking for that quick fix, not recognizing how much you're putting yourself at risk. So you may not feel dizzy, or you may not go to the bathroom frequently, but guess what? You've just did some damage to the blood vessels in your kidneys, right? So the right dose, that is very important. And it's important for us to, as pharmacists, recognize dosage forms as well, because some doses can be written, some medications or prescriptions can be written erroneously, or they can be written irrationally. And so pharmacists, as you talk about and you spoke about, attention to detail. So pharmacists have to pay very close attention to dosages, because that's why in dosage calculations we calculate age, weight. Your weight as well is very much important in the dosage. Okay, we also have to factorize your underlying condition. So you might have, let us say, a liver problem. You have a liver problem, liver cirrhosis, and the doctor prescribes an antifungal oral medication for you. We should know that that is already contraindicated because you have a liver problem. And these drugs are generally broken down by the liver. So right away, the pharmacist should know to call the prescriber and say, the patient has XYZ. The doctor might say, well, okay, we are aware of that. We've done a liver function test, and this is what the levels are like. And so we've taken into consideration, and we have decided to give the patient this dose, or we can reduce the dose if you feel, the pharmacist feels, well, okay, I still have some concerns. Then the doctor can talk and they can come to a conclusion. But the right dose is very, very important. The number four, the fourth R is the right route. So you have medications given in the nose, in the ears, in the mouth, underneath the tongue, on the side of the cheek. Um, you have medications given in the eye. You have medications given intramuscular, that is through your muscles. You have those that are going subcutaneous, underneath the skin. You have those that are given through the veins, IV. You have those that are inserted in the vagina, in the rectum, right? So medications can be used. Or you also have patches, you have rubs, we have creams, we have all of these things, ointments. So all these different forms of medication would also warrant the route of administration. Where is this medication going to be used? There are in some cases, that person may not be able to use the oral route because they might be vomiting profusely. And so therefore we have to use the rectal use,
No
if it's
suppository.
in a suppository form. Sometimes too, the person may have sensitive stomach. So they may have peptic ulcer or duodenum ulcer or something happening, especially bleeding in the stomach. Then the doctor would have to use an alternative route to prevent further complications of that organ. So knowing the route and adhering to the route is very, very important. Some of the routes are used to have what we call a greater absorption or faster absorption or faster efficacy of the drug, so that the drug can get into the bloodstream much quicker and you can get a release much quicker. So you are in intense pain. The doctor will not waste time and give you a diclofenac tablet if you're in the emergency room. They might come and give you a pethidine injection
Okay.
or a morphine injection, intramuscular,
Mhm.
all right, to calm you down, and that they can be able to, you will be more relaxed, because the more hyper you get, the more likely that your blood pressure can rise.
Okay.
And so they would want you to be calmer so that they can do further investigation and you can be better. So the routes could be determined based on the type of medication that is going to be given, the urgency of onset of the medication, and also to the adherence of the medication. Because some people they don't like the medication on a particular route. So the doctor might say, okay, well, we will give it to you to use via the vagina or via the rectum, depending on the medical condition. Okay.
Mhm.
The last R is the right time. And that's where many people fall short. The right time of the medication.
Mhm. Mhm.
And timing is very, very important in terms of your medication. You may have 3 different eye drops, right? And you feel like you want to put all 3 back to back to back, where the doctor may have told you you need to space it out. Or you may have to use 3 different eye drops in the morning, but you may have to do a 15 minutes interval per administration of each of the eye drops,
Mhm.
right? Because the mucous membrane in the eye is very, very porous, and it is absorbed very, very, very quickly. That's why some people, when they use certain eye drops, we call them beta blocker eye drops, they can drop your blood pressure almost immediately and can make you even feel dizzy, right? So if, for example, you're using one of those eye drops, for example, for glaucoma, and you're using high blood pressure medication, we would advise you to use the eye drop first, right? Use the eye drop first, 30 minutes after, then you take your blood pressure medication. But you would want to do your blood pressure prior or after or before. So after you've used the eye drop, 15 or about 30 minutes after you take your blood pressure, you see what your blood pressure reading is like. Because if your blood pressure has plummeted, gone very low, then you don't want to take a blood pressure medication to bring it further low, that you can get into hypotension, which can also cause you to have a coma and even a stroke. So these are things that pharmacists can tell you. And these are things that we want, a lot of the times we want to sit and we want to tell you, but most of you are so busy when you come to the pharmacy that you don't even want to listen to the advice of the pharmacist. You tell yourself you know it all. You tell yourself you can Google it. You tell yourself you don't have the time, the boss waiting for you, and
Mhm.
all of these things you say. And I see it over and over and over. Even sometimes giving information regarding the elderly and children, people are too busy to want to listen. I have seen, Judy, I've seen people use suppositories by mouth. I have seen people use pessaries that's supposed to be inserted in the vagina by mouth. They didn't read the direction.
Hmm.
So the direction is properly labeled for them, typed, and sometimes we do ask you if you're literate or illiterate, that we can sometimes use color codes to differentiate things for you. So I may tell you the one for the morning, I put a bright red asterisk by it, so you know it's morning time. The one for the afternoon, I put an orange asterisk by it. The one for the night, I put a green asterisk by it. So by the color codes, it helps you to be more adherent and to know what time to take your medicine. Okay? So we were talking about, let me take this caller first. Good morning to you, caller. Thanks for calling.
Good morning, Carlton. Good morning to your co-host.
Yes.
morning.
Good morning, Miss Lucille. Good morning.
I know you know the voice well.
Yes, ma'am.
Carlton, I don't know. I worked 29 years with health.
Yes, ma'am.
And I've gone to pharmacies and witnessing people don't want this. You just said it. Don't want to listen
Mm-hmm.
to what the pharmacists are telling them. Pharmacists telling you, well, they have changed the medication because of that. So listen
Mm-hmm.
to me why you have to take it that way. Oh, I will know. I will see it on the thing. I'm busy, but waiting for me.
Mm-hmm.
That is not the way. That is not. You cannot take chances with medication.
Mm-hmm.
Carlton, I don't know if because I worked with health for a long while. I know the both names of all my medication. Generic
Great.
name, all, everything.
Awesome.
I know that one I should not take it on empty stomach. You know, I have to make sure I take my breakfast and whatever
Mm-hmm.
because it can do anything.
Mm-hmm.
And some people will go and they will tell you, I met one this week. They come to the pharmacy and they say, it's in a yellow box, in a that box. People don't go by those
That's
things
it.
there again.
True.
The name.
You need the name. Mm-hmm.
It could be something you rob in. Find the name.
Take out a picture of
If
it.
you will not remember, write it. Take it and write it on a piece of paper.
Mm-hmm.
People don't do things like that again. Now it's modern technology.
Mm-hmm.
So then the pharmacist can help you on it. But you cannot say, especially, I was taking a red medication. Why they give me a white?
Mm-hmm.
Medication changes in color, in everything.
True. Thank you, caller. Very good.
Well,
message.
I don't know.
Very good.
You see my free meal? I know I have to take the free meal for the medication to work. But I'm concerned about my medication.
Mm-hmm.
And before I think I forget, I am easy to forget those days. I put it by my breakfast or by my lunch or whatever. How many times I have to take it.
Mm-hmm.
You have to be careful with medication. And I learned that and I'm following that same procedure.
Mhm.
And I'm never too busy
True.
for pharmacy, especially Jolly Pharmacy. Oh, I always tell them just my wardrobe that is not there. And I have a daughter they call Gemma.
I know that.
That's my daughter.
Yes.
She's so nice. But praises to all of them, but
Yes.
Gemma, I must believe Gemma.
Of course.
And she's good. And I love her.
Definitely. I know
And
that.
Jolly Pharmacy people keep on the good will.
Thank you. Thank you, Miss Lucille.
All right.
Thank you. Thank you so
Okay.
much. And again, I'm glad that a caller and a consumer could have recognized that. That is dangerous. And people get very angry. You know, oh, are you saying that I cannot understand or I cannot read? So we're not saying that. It's our responsibility to educate you on the medication. Because guess what? This medication, whether you like it or not, it is going to alter the normal functioning of your body. And you need to know the pros and cons about it. So we
Yes.
get that a lot.
Mhm.
There was something too that I wanted to say quickly. As she mentioned, the callers.
Uh-huh.
People expecting the
The
pharmacist to
differentiate.
know everything about the medication. You, a customer shopping at another pharmacy, you've come to Jolly's and you want to get angry with me because I cannot identify the blue little tablet
Mhm.
that you're talking about. And then you want to tell me I'm stupid, what kind of pharmacist I am, and the list goes on. And we know then that is pure ignorance.
Mhm.
And
But-
we see that a lot.
But Carlton, even and it happens even within the same pharmacy. It doesn't mean even if you come into the same pharmacy all the time, but the brand or the what you call it, the
generic.
manufacturer or
Mhm.
whatever might change. So you might have metformin from one manufacturer one time, but the next time you fill your prescription, it's the another. So the shape is maybe different, or the color of the box, or something is different. And but it's the same medication. So identifying by the color of the box, the shape or size of the actual tablet or whatever it is, or the color is not foolproof.
And I like that. That is another fact. And we've always said to people, if you have been given a generic medication, so let's say you're taking metformin, let's say you're taking glucophage, the brand glucophage, right? Which is the same as metformin, but it's the brand name glucophage. And that's what you're accustomed of taking. That's what you prefer. But this time we're out of the glucophage brand. and we give you a metformin from Canada, a generic from Canada, let's say from Apothec or some other company. And when you take it, you recognize it's giving you a particular side effect that you've never had with glucophage.
Mm-hmm.
We want you to tell us.
Mm-hmm. Mm-hmm.
We want you to tell us because sometimes that happens, and it's not about the actual active ingredient, which is the metformin, but it could be inert active ingredient. It could be a coloring,
Mm-hmm.
it could be a binding agent, it could be some other inert active ingredient that you might have an allergic reaction to.
Right. Right.
So it's not a matter of just saying, oh, that medication can almost kill me. That medication, it could be other little things in there, such as coloring, preservatives, flavoring aids, binding agents. All of these are used in the formulation of medications. So let us not be quick to just assume that a medication or a particular active ingredient just almost kill you.
Right. Right. Carlton, I know you mentioned some of the things that can happen in terms of errors, medication errors. You've been mentioning the generic brand versus the brand name. What about the misinterpretation of a prescription, the writing? Is that something that can happen?
Definitely. And I remember beginning the discussion, I said that I have made a few errors as a
Okay.
pharmacist in my profession over 25 years. I remember one year I was working on St. Kitts and I got a prescription, and the prescription was written for Proviron, right? Proviron, which is a like a testosterone booster for men, right? So the prescription was written for Proviron, but I saw Piriton,
The
right?
allergy
Right.
medication.
So I went and I typed Piriton. Truly, I am certain that like 3 minutes after the person exited the pharmacy, I went back to the batch of the prescription. I don't know if it's like a spirit or something. Just tell me to go back to that prescription and look. And when I look at the prescription, I'm seeing clear. I'm seeing like immediately now it's Piriton. Right now, Piriton is an antihistamine. Right. So luckily, the patient number was on the system, and I called and I said to the patient that we just need you to come back to the pharmacy. There seemed to be something relating to your medication, and we discreetly changed the medication. You understand? But it happens. You rush in a pharmacist. You making noise with a pharmacist. You they're saying so long they're doing. I don't know what they're doing. You maybe have a music loud, or you making a lot of noise, or there's so many things that can actually cause medical errors. That's why you go to the hospital, and generally there is a standard. There is a standard of care. There should be a standard of care. There should be a standard in terms of noise, pollution, and all of those types of things. Because simple things like you there, I done a prescription for you, but I'm listening to Matt in the morning. And Matt have a hot topic, and I'm not, it's like my brain is more on Matt versus filling the prescription. And that's why at Jolly's we don't listen to talk shows. No talk shows. It's played on our radio. And because people can get caught up, you can get emotional, and things can happen. And so to prevent this, that's where, again, attention to detail. One of the things we do as well, if a prescription is written and one pharmacist cannot make out what it is, they ask other pharmacists.
Okay.
We have a group chat. We will send it in the group chat. Maybe it will reach as far as Portsmouth to the pharmacist there. And then we get a unanimous decision as to what do we think this drug is. If it is still inconclusive, then we call back the prescriber.
Okay, because I was going to ask, are there situations where you just call the doctor? Yeah.
In some cases, we do. Particularly if it's more than just the handwriting. If we recognize the dosage is not in sync or it doesn't seem to be right, then that also adds more, because you don't want to call the doctor for one thing and then afterwards you recognize another thing, then you have to call back again. So we
Okay.
try to make sure everything is rational before we have the whole case in front of us
Okay.
before we actually call and put the case in front of the doctor. And again, too, I should let the callers know too that the doctor is not always right, and the pharmacist under the law can refuse the filling of a prescription if the pharmacist recognizes or is not in, based on his knowledge and his competence, is not comfortable with the choice of drug, the dosage of drug, or the regimen of the drug, then even after consultation, the doctor still insists that's what he wants, or that's what the patient should get, and the pharmacist is not comfortable dispensing it, the doctor cannot force the pharmacist to dispense it. So I want people to know that as well. And this is a forensic pharmacy discussion. We get into the legal aspect of pharmacy, because if something were to happen to the patient, the pharmacist could actually be more at fault in terms of prosecution than the prescriber who wrote the
Right.
prescription,
Right.
because the pharmacist is the drug expert in the chain of command and not the doctor.
So, Carlton, as it relates to this whole legal aspect, because I'm thinking, what if you have a particular prescription? I don't know if that happens, so you can let me know. And the use of this particular drug is for something that is illegal. Let's say the person does have a prescription, but it's something that can maybe cause a high, or something that can be abused.
So one of the control drug.
Yes, right. But they do come in with a prescription from a doctor. What is the legality in that for the pharmacist? Oh, I see. We got.
That's a good question. I will definitely answer that. Let's take this caller. Good. All right. Let's
Caller,
just,
you can try again.
Let's just give the numbers again: 449-3095, 449-3096, 449-3097, 616-4257, and of course, you can call from overseas if you reside out of Dominica. That number is 305-432-9624. Let's take this caller. Good morning to you, caller. Thanks for calling.
Hey, good morning, Falcon.
Good morning to you,
Good morning,
miss.
Trudy.
Good morning. Good morning.
Thanks for the information that you were sharing there. I greatly appreciate.
Thank you too.
But my concern is that I have been on diabetic medication, pressure medication, glaucoma medication, and all my medication is being bought at Jolly's Pharmacy. And the information that you're sharing today, not once have I been told about it.
It's
I was
unfortunate.
never told. It was never written on my receipt on the medication. And another thing, grapefruit juice. I only learned about not taking grapefruit juice with pressure medication. I did not know that. I only learned that from your program. So there's a lot of things that you're saying there, and a lot of them, the pharmacies don't ever say those things to us.
Okay, that we will definitely take note of that, and I will pass that information to my colleagues for them to make sure that that is improved in terms of information, and that is credible information. Okay.
Thank you.
Point taken.
Bye. God bless you.
Yes,
Good
ma'am.
program.
Thank you so
Enjoy it.
much. Now that you raised an important question. So, for example, a prescription, we receive a prescription for, let us say, Ritalin, okay, or let us say oxycodone, or pethidine, or morphine, or codeine, or diazepam, which is Valium. These drugs are all control drugs. And you see diazepam 5 milligrams to be taken 3 times a day for 6 months, what should the pharmacist do? In the first place, what the pharmacist should do is one, um, recognize that this is a controlled drug. Two, um, look at the demographics of the person, see, okay, maybe go into the person's profile, see if that there is a history of this drug in terms of usage or drugs that are similar, right? Look at medical conditions that this person has, because this drug, if it is misused, it can cause dementia. It can actually cause memory loss, right? So a lot of people don't know that. The benzodiazepines, the Valium, the Xanax, these drugs that people like to take to sleep, if they are abused, they can cause memory loss. Okay? And they can cause addiction too. Then we look at what rationale is for the 6 months. The patient will not be able to answer that question. We call the doctor and we say, Doc, I recognize that you are given this drug for this length of time. If it's a psychiatrist, then there will be a bit more merit to it because it's coming from a psychiatrist than if it's coming from a general practitioner. Though we still have a right to call a psychiatrist and ask a question. The psychiatrist might say, well, such and such a person may be traveling, and hence the reason I give
that
period
length of time. Okay.
You understand? So it could be certain things. We would want to know what is the rationale.
Right. I
But
see our
we have a
lines are
call.
going. Yes. So let's take this call. Caller, good morning.
Carlton, it's me again.
Yes, ma'am.
I know of, I don't want to say the lady is not speaking the truth, not that. I know of, even though they don't tell you about those things, there is a long leaflet sometimes they put in your
That's very true. A monograph. It's called a monograph.
Go
Yes.
at your home and you sit down, you read. Because even though I work in the hospital, there is a lot of things that I know about certain drugs I take that I did not know about, and the leaflet has it.
Yes, that's true.
So you take time to read your leaflet so you can know.
Very good point.
Yes.
Yes.
Thank you. And I will add to the little stickers, the little caution
Yes.
stickers
The
on
auxiliary labels.
Yes, on the packaging itself, because I have seen packaging, with the label, no, for instance, no grapefruit juice or
No milk, no
right. So I
dairies.
have seen those. So it's also important in getting the medication to look at the labeling that's on there.
That is true. That is true. So again, the pharmacist has the power to do all of this probing. It's not a matter that we want to know your business. Sometimes I remember distinctively, an insult one of my colleagues got from a patient, like saying, why are you going for my book? I feel like coming and punch you,
Wow.
and things that are not recognizing that we were intercepting something. One doctor, it was at a hospital health center system. One doctor wrote something wrong, and all the other doctors after that kept on writing the wrong thing. And we wanted to see where did it begin.
Where did the mistake
Because
begin?
the dose
Okay.
it was just off.
Okay.
But the patient doesn't know, and they feel, it's sometimes it's a lot, and we recognize the importance of really having to educate our public on the role of the pharmacist and why do we do the things that we do. It's really to protect you and to ensure that you are getting the right thing. Let's take this caller. Good morning to you, caller. All right, we've missed you. Feel free to call back again. 449-3095, 449-3096, 449-3097, 616-4257. It's a topic you'd recognize that I'm quite passionate about.
Yes, the caller is back.
Good morning to you, caller.
Good morning, Mr. Carlton and your co-host. Long I haven't said hello to you.
Yes, Nils. Good morning.
Right, but I'm listening. Very good program this morning. I'm really learning a lot. And even sometimes when we get our prescriptions, they still will always send a little leaflet. We need to read because things that we're supposed to do sometimes change, and you only know that when you read and you know about the drug. So anyway, good morning to you, Mr. Lando,
Yes, miss. Yes, miss.
and Miss Giddens. I love that lady.
I
Because you big nowhere, you all over, so I don't see you.
yes.
And the one, what is her name there now?
Mrs. Dover?
Dover. These are my
Yes.
girls.
Yes.
Don't take it wrong. I love you. Don't
Of
make nobody
course.
think I put you wrong. You on top, but you see them.
Yes.
When I have my problem, I can call, I can speak, I can ask for advice
Yes.
because we all live with problems every day.
Yeah, of
Love all
course.
you. Bye
Thank you,
bye.
Liz. Thank you.
Mhm.
Yes.
Carlton, I will say too, as it relates to what you were just mentioning about, patients maybe getting antsy with the pharmacist, that this is why what we're doing here this morning is important for people to understand, but also communication. So I think it's okay for the pharmacist or for the assistant to say, just be patient. We are actually checking
Yes.
for something.
Yes.
So just communicate with the individual, because with the lack of knowledge, the person will think something is wrong, or why is it taking so long, and you know what I mean.
Good
So just a
observation.
little
Mhm.
a little comment might allay those fears that the person may have.
Very true.
Yeah, our lines are going, Carlton.
Good morning to you, caller. Thanks for calling.
Hi, good morning, Carl, and how are you?
I am doing good. This sounds like Mrs. John.
Yeah.
Mrs. John, how are you?
Cool, cool. I heard you asked about me.
Yes, I did. I did.
It's been a long man.
I know. Good to see hear from you.
Okay, bye. I've
Okay.
still got the same number.
Okay, I will give you a call soon. All right.
Okay.
Yes.
Mhm.
Let's take this caller. There's another call. Yes. Good morning to you, caller. Thanks for calling. Good morning, caller. You're listening to yourself. Good morning. All right, let's take this other caller. Good morning to you, caller.
Good morning.
Good morning to you, sir.
Yeah, I just want to make the observation that I know a few diabetics, and it seems to me that they are not on the game information wise as to their condition and the treatment. I mean, they go as far as checking, the sugar and so on, but they don't understand the whole sequence, the continuous levels of sugar changing, the overnight drop. There's a lot of stuff. It seems to me that they should get a little more education in that department. As well, again, the senior ones, I excuse, but even young ones, I find that they're not up onto the game. I'm not a diabetic, and I've learned a lot about diabetes just from talking to them and reading.
Mhm.
You think there's something lacking there, Carlton?
And that's a good question that you've raised. Right now, we have an endocrinologist on the island. We have another diabetes specialist on the island too, Dr. Lisa Jolly. I know that she does a lot of illustrative work in her office in terms of charts, in terms of food portions, in terms of food care, all the things that people should be able to do, and she would tell them. So sometimes I know that the primary healthcare system, they do a good job too in terms of education. I think sometimes people are just not um, maybe taking the advice as
And
it is given.
here's another thing. I start taking the advice, read diet, and being very compliant with my diet. What's going to happen? Well, my sugar is going to drop,
Mhm.
and I might have to get off the medication, get not as much. So, that's another thing, that when they become compliant finally, somebody has to be watching them, because then they might be just taking too much medication.
Mhm. Thank you very much, caller, for calling.
You're
Appreciate
welcome.
that. Appreciate your contribution.
Let's take this other
Yes.
call. Caller, good morning.
So good morning. How are you?
I'm doing
Good.
well. Good morning to you.
Okay. I wanted to ask a question
Mhm.
because you're saying about when you buy the medication and it have the replace in it. But usually, sometimes when you buy your medication and there's a replace, usually it's in French, so you cannot understand anything in it.
Well, not all in French, because usually when the prescription is processed, it comes with an English monograph. So that's a paper that is given with your receipt. So if you look at that receipt properly, you will see that the monograph is attached with it, and that will tell you your medication. Because some of these medicines, we do get some of them from the French countries, and may not have the paper that's in the actual box may not have. It's supposed to have some English, but if it doesn't, the actual monograph from whence we've processed the medicine will be in English interpretation, and you should be able to get all of the information. Let me just say quickly, though, as we're talking about the monograph, that I've seen people come back with the medicine and say, I do not want this medicine because of what I've read. And they get scared and they overreact, they get anxious, and they will like, why would the doctor give me a medication that's going to do X, Y, Z to me? Let me just say, from a pharmacological standpoint, that every drug that is produced must go through testing. Okay. They normally test them on mammals, whether it's rats or um, um, monkeys, or they try them on mammals. And based on the side effects, based on the reaction, they will be able to tell that it's going to do the same thing to us as human beings, because we're mammals as well. Right?
Okay, thank you.
The litigating aspect of this is that all of the side effects, no matter how mild it is, must be documented for litigation purposes, or to avoid, for if, for example, somebody decides to sue, the manufacturer can say it was documented. Now, you will also note, well, you may not know too, that adverse effects and side effects are put in ranks. So you could have rank 1, rank 2, rank 3, and even sometimes rank 4. So you could have the most common side effects would be in rank 1. The least side effects could be in rank 3 or even 4. And the rare side effects could be in 4. So they put them in ranks as well. And this is just to protect the company. So it doesn't necessarily mean because you see something in rank 4, you may experience it. And so I wanted to highlight that
Yes.
one time.
Carlton, let's see if we can take another call. We're almost at the end of our time, but the lines are still going. Let's take this other call. Caller, good morning.
Good morning to you, caller.
Hi, good morning, Carlton.
Good morning to you, my
Good
friend.
morning, Judy.
Morning, good morning.
I'm just saying hello. I'm listening.
All right.
Okay.
And Judy,
Yes.
you did a very good job last night on
Thank
the
you.
other radio station.
Thank
I
you.
love
Thank you.
Calypso.
Thank you, Vado.
Yes,
Thank
you
you.
did a very good job for your first time.
Uh-huh.
Really good. And you did a good job on Saturday also, Judy.
Okay.
Okay?
Thank you. Thank you.
Yes. So, Carlton,
Yes, my dear.
have a blessed day.
You too. You
Okay,
too.
then.
You too.
Bye.
Bye-bye.
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 Yes, but
Yeah.
let us just go quickly through some of the risk of drug and medication errors. Death can occur. Yes, you can die. Life-threatening situations, meaning that you could be in a coma, your heart could stop beating properly, your liver and kidneys can malfunction. You could end up having hospitalization. You could end up having a disability. You could end up having a birth defect if you're pregnant. You could end up having financial, psychological, and emotional stress. So these are things that can occur because of a drug error or medication error. You want to be careful with that. I've spoken in the past about polypharmacy. That is people who are taking multiple medications and bringing those medications in to a pharmacist, because we've seen people who may take medications from health center, buy medications privately, have different brand names or generic names, and taking the same drug because they don't know it's the same drug, because they have different names, but it's the same drug and could cause major, major problems. So we're saying to you, take your medications. If you have a pile of medication, you're taking care of your grandmother or your mom who is home, she goes to a health center, she still buys from private pharmacies. Bring all the medicines and speak to your pharmacist, whether it's in the health center, in the pharmacy there, or private pharmacy, whichever pharmacist that is your friend or you patronize. Work with those medicines and help them. They might help to they will help as well to make sure that the person is not overdosing and they're getting the right medication. Again, the sharing of medications, you should avoid that. you should avoid that. The age appropriateness of the medication should be taken into consideration. Not understanding your directions, especially in the health center system where they still write on prescription bags. Every pharmacist's handwriting may not be the same. Ensure before you leave, you tell them that you cannot understand what they've written there, or you may not be able to read. So you want to know, if they tell you one a day, what time a day are they talking about? Is there a specific time of the day? Should I take this with food or without food? Should I take this with a particular food or a particular drink to enhance the absorption of the drug? So all of these things you want to know. The storage of the medication. Where should I store this medication? Should I store it on the fridge? Should I store it in room temperature? Should I store it, in the freezer? You need to know. The use of the correct measuring device. A teaspoonful is different from a tablespoonful. Should I use a syringe at times? So you need to know how and use the right measuring device. Following the regimen, not doing what you want. So you forget your birth control yesterday, and because of that, you decide you're going to take 2 tablets because you forget. No, that is not necessary. You just continue with the 1 pill. These are things that we've seen people do over and over and over again, make these decisions on their own without consulting the pharmacist to advise you, or even calling your doctor to advise you. We wish we had more time because it's a very pertinent topic. I suspect it is one that many people may not have been so conscientious about in terms of the knowledge and the information. Information is around you, it is accessible to you. What we want you to do is to utilize it. Find yourself a pharmacist that you trust, that you believe is competent, is knowledgeable, can interpret, can give you the information that is credible, not no guessing information. Information that is credible, that you can see for yourself. That I'm not purporting that we know everything and we can answer every question that you have. That includes myself. There are things that I still don't know. It's not of my expertise. Don't bring your ECG results for me. I don't know how to interpret that. Don't bring your CT scan or MRI result for me. I do not know how to interpret it. I might be able to read the report and might be able to tell you some of the things that it is saying. So I don't know everything. I'm not purporting to know everything, but I'm saying to you, do not rush the pharmacist. Be respectful to the pharmacist. If you even leave the prescription, go and do your business, do all what you have to do, and then come back, rather than you there forcing and making noise and something goes wrong. We want to thank you for your time today. We want to thank you for listening to this relevant topic.
Yes, Carlton, and of course, I particularly want to tell our listeners that next week we'll be back on with you as usual, God willing, and we have a very interesting guests coming on from the Trinidad Fertility Clinic. So, just to let our listeners know, particularly those who may be interested in what are the options for if you want to have children and you've been struggling. We do have some guests from Trinidad fertility specialists with us next week.
And as Trudy is saying this, it is not only for the women.
Right.
We do have men who have difficulties conceiving as well.
Of course.
So it's not just for the women. And even if you're a man and you don't have the problem, but you want to support your lady. So your lady may not be able to listen, but you can listen on her behalf and you can make a more informed decision.
Correct.
So next week, again, we're having some experts from Trinidad who are experts in fertility medicine. So those of you who are looking at wanting to get pregnant, wanting to be with child, wanting to have that bundle of joy, stay tuned. We always source. No
Yes.
matter where, we source
Yes,
them.
yes,
We
always.
source them.
So yeah, so Carlton, that's it, and God willing, next week, as always, we'll be having a good show. So goodbye. That's goodbye from me.
Yes. So, and as usual, we always say to you, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and remainder of the week. And again, if you are participating in the carnival activities that is scheduled for the weekend, I know St. Joseph opening, and maybe all of us are looking forward to that. I don't know about Trudy, but it's me where I live in Trudy. I can run to St. Joe. I can leave my vehicle, St. Joe. So I know that many of us are looking forward to that. Leave the weapons away. And I know that every time St. Joe opening, I don't know if you've been to St. Joe opening.
Never.
Well, you should come. Trudy will be my date. Trudy will be my date for the opening of St. Joe Carnival. Police are always present on the road when you come to Hillsborough, SSU, and all of that does be there, searching for weapons and
Wow.
all of those things, because they know St. Joseph is like the biggest opening ever. And so if you're planning to enjoy the carnival this weekend, the activities, don't do nothing stupid.
Good advice.
And don't put us at risk.
Good
Take care,
advice.
everybody. Have a good weekend. Good rest of the week.
Goodbye.
Bye-bye.
Say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
The romance begins from the very first sip. Treasure the rare, inviting richness found in our light wooden notes with a hint of vanilla. This rum is aged in individually selected